The last part of the assessment is completed with the client sitting on a firm surface with the thighs and feet supported. You're going to be assessing the effects of gravity on the client in this position. Again, it's really helpful to have a second person, especially if they need help sitting up. So the first thing you want to do is accommodate for any orthopedic findings that you found when they were in supine. If they have tight hamstrings, you may need to bend their knees a little bit more. If they had some problems with their pelvis, you may need to put some support under one side if they had a hip obliquity. The first thing you want to do is look at their sitting balance. You want to know if it's independent, they can sit without any help at all. If it's hands dependent, where they need to prop on their hands, or if they need external support. If they need external support, you need to note how much. Just a little bit, a moderate amount, or they're really dependent. So that you want to also observe their posture and sitting. You want to note if it's flexible or fixed. One of the really good keys to finding out whether it's flexible or fixed is if the posture is present in supine and sitting, it's giving you a clue that it's a fixed deformity. If it's not present when they're lying down, but you see it in sitting, it's giving you a clue that it's a flexible deformity. So you want to look at the range of motion, again, between the spine and the pelvis. You want to begin to look at how they're sitting. You want to look at the iliac crest height. Is it level? Are they in rotation? Again, as you're moving, you're feeling for resistance. And you want to find the point where there's no resistance, but yet they're as close to neutral or as close to optimal as you can get them, close to ideal. So now with your pelvis in that optimal alignment, you want to then begin to go up the chain again. You want to look at the trunk. How much posterior support are they needing to stay in that good position? Do you need to add lateral supports? If you have to add lateral supports, how much pressure are you putting on? And what position is the best way to support them? Is there a unique shape that you're going to have to accommodate? Do they have a kyphosis? Or do they have a scoliosis? So now with the trunk and the pelvis in that ideal or as close to neutral as you can get them, again you want to then begin to look at the head and the upper extremity control. The other thing you want to do in this position is take critical measurements. Some helpful hints. You want to be really aware of baggy clothing. When you're measuring with a tape measure, you want to make sure you keep your tape straight. If you have calipers available, that's really great. If you don't, one of the other things that's really helpful is just to have 2x4s that you can use to help you with your measurements. It really helps to make your measurements a little bit more accurate. And again, when you're measuring, make sure you're doing both the right and the left side. So some of the measurements that you need to take here are the hip width. You also want to make sure that you note if the hip width is actually the widest part. If they have windswept hips, the widest part is going to be not at the hip width. It's going to be a little bit wider, and you want to measure that and make note of where it is. You want to look at the firm surface to the top of the head, to the base of the skull, to the top of the shoulder, and to the tip of the shoulder. And again, you're looking at left and right because it may be different. You also want to look at the sitting surface or the firm surface to a bent elbow and measure it. These are all on the given form. And you want to look at the surface to the height of the iliac crest and measure that, again, on both sides. We have a few more measurements that we need. The client is in the same position, but I find it really helpful to move to the front. We need to get the measurement between the knees, and then I also like to take the measurement that we looked at in supine, again in sitting, because it may change. You want to get the length from behind the buttock to behind the knee on both sides. You also are going to need the floor to the back of the knee on both legs, and the last measurement you're going to need is the foot length on both sides. So the MAT assessment provides a clinical assessment of posture, joint range of motion, flexibility, their skin status, the balance and control as it relates to seating. Thank you for joining me for this video.